Hey, good afternoon, Andy.
Hey, how you doing, Nadine?
I'm doing really good. I'm doing even better now because you are joining our team at Dorigo and Diaz. And
I'm looking forward to it.
psyched about this
Yeah,
because I I hate that I'm this old, but I have known you. I'm gonna spill the beans. I've known you for 37 years.
that's pretty scary, isn't it?
I don't know that happened. I did not know. So I met you when we were baby prosecutors at the state attorney's office.
That's pretty wild. We were about the same age as our kids, which is
That is even
pretty
more
scary.
weird. I was 23 years old when I started practicing law. I was a child and I did not have any idea what I was doing. And I went to the state attorney's office, and you were already a veteran there of like a whole year or something. I don't know, maybe two
It
years.
only takes about 2 months, and then you're a veteran.
Oh, yeah, yeah, because the turnover is so much, right?
Yeah, and they throw you right into the wolves.
They threw you right to the wolves. They certainly did. So we tried a lot of cases there,
That's
met a
right.
lot of people, had a lot of fun. Probably,
I like the high fives after we get a conviction.
oh, when I think about what bad taste that is, somebody's going to jail and their families are crying and we have no life experience. So we're like, great job, Now when I look back on it,
We would never do that now.
no, we've got different perspective now, and that's for
Right.
sure. But since that time, you have become quite the trial lawyer, very well respected in the community and auto accidents, premises, but also developed specialties of medical malpractice and nursing home
Right,
cases.
right. I've spent the last 25 years working nursing home cases and medical malpractice cases. I'll start off with nursing home. I kind of got in the field because my father, he became ill,
Mhm.
and my mother needed some respite care just so she could breathe. And checked him into a nursing home facility briefly. He was only supposed to be there about a month, just to give her a break. And
It's hard when both of them are elderly and they're both struggling
it
with
was
issues, and
it was
one
it was
is
difficult, and I'd go visit, and it got to the point where we had to remove him. He didn't make it but about a week and a half. I just saw the way he was being cared for or not being cared for. Those issues kind of spurred me into going to work in the nursing home field, pursuing claims against nursing homes for violation of residents' rights under Chapter 400 Florida statutes. So that was my start.
when you see those cases, they're shocking. I mean, you told me the other day about a case where you could see all of the because of the ulcers, all of the person's spine, all I mean,
It'd be
just
like someone laying on their backside and not being turned and repositioned for weeks. And over time, there would be a lack of blood flow to the tissue, so the tissue dies and essentially rots away. And so I've handled multiple cases. It's catastrophic. It's so sad that our elderly would be treated like this. I mean, there's actually the size of a fist all the way into the skeletal system of a resident. So you see their actual spine on the
uh,
backside. It's horrible, horrible.
and the thing is that like my mom is at home, and thank God that she, saved enough money where she has, we're able to hire somebody to stay with her. But when they get to the point where if they're, losing, their faculties and you can't control, like my aunt was trying to get out of the, trying to get out of the house and running into the street and, or if, they're going to be fracturing a hip without somebody 24 hours and you just have nobody to do that, to supervise them and help them.
So again,
Then they end up in these places and you pay an arm and a leg, but
they're not cheap. Unfortunately, my mother subsequently developed Alzheimer's dementia, and we kept her home as long as we could between my sister and I, but we ended up, I guess, she became a resident of a nursing home. Actually, it was an assisted living facility memory unit. And the first one, I think she fell and fractured a hip.
uh,
The next one, she wanted to get out and into the playing area outside, and they wouldn't let her out. So she sat on the floor and beat her elbow to a pulp, fracturing the elbow. So
nobody was
again,
watching her at all.
lack of supervision. These facilities are all about the bottom dollar, and so they staff minimally, according to Florida statutes or the Florida Administrative Code. And what that means is having like one person per 20, per 30, and that's about it. And so they keep, they hired staff, and they hire the minimum number of people to watch residents. It's unfortunate, but that's the system we've come down to with regard to the elderly that families aren't able to care for at home. And I understand you. Once, my mother became very combative. She was very difficult to handle at home. But again, the lack of mobility, she's stuck in her bed or in a wheelchair, but she was able to get out of the wheelchair, get down to the ground, and beat her elbow to a pulp at some point. So it's tragic and it's sad.
And so that's kind of what spurred you into the nursing home world, right?
That was what was with my dad. That just this came years later with my mother. So I was already handling nursing home violation of rights and negligence claims. So naturally, I got into medical malpractice from the nursing home realm. So over time, I began picking up medical malpractice claims and learning the medicine. And so my wife thinks I'm a doctor. I'm not a doctor, but the knowledge.
You know a lot of things about the medical world that most of us do not. Some of that is merciful, because if you go into a procedure and you know a lot, what ends up happening is you are, to some extent, you have to quiet the demons. You're a little freaked out because you know everything that can happen. Well, not everything, but a lot more than you would have had you not been in this line of work.
But that's people need to understand, from just going and getting an injection at your doctor's office to undergoing a colonoscopy, just the natural medical care and treatment you would get as you age. There are potential known complications. You could get cellulitis, which is just a skin infection from an injection. The injection could actually, they can't see what's underneath the surface. They could actually hit a nerve. So there's, these known complications with any medical procedure when they pierce the skin, and when you're undergoing a colonoscopy, they could have some difficulty getting the colonoscope up there, and they could take a wrong turn. It might be a little difficult pulling it back. And next thing you know it, you've got a tear. So,
I mean, we have to have medical treatment in our lives, but it does teach us that we have to not take it lightly, not necessarily rush into things, that are extra, whether it's cosmetic surgery or something like that, and be aware, be aware that that we want to check out the qualifications of this doctor. You just don't want to maybe take the next guy that they lined up for you if there's a referral.
I think it's important to look into the background of each physician that's going to provide surgical care to you. I also know that in talking to potential clients over the years, there are known complications with every procedure. And what you're given as a patient going in is an informed consent. And the informed consent is oftentimes either given to a patient as they're going into the OR and they're already medicated.
You consent to all these.
Yes, and you just sign it as they're throwing the paperwork. So no one's ever explaining to these patients, hey, look, this could happen, this could happen, this could happen. What the doctors typically do, despite what they testified to once the case is in medication, what they usually do is just say it's a walk in the park. There's nothing to be worried about. And so when patients awake and there's been a complication that's occurred, they're like, I didn't know this could happen. And the next thing you know it, they're calling me. And I've kind of got to listen to the client, the potential client, and kind of convey to them, it's unfortunate.
It's heartbreaking sometimes.
It's tough for me to convey to someone, hey, look, you just don't have a case. That's a known complication. Mm-hmm. And that happens a lot.
Now, I remember I was very grateful for the gynecologist when I was obstetrician. When I was having my son, I was 36 with my first child, and we talked about the amniocentesis, and I'm a chicken shit when it comes to injections anyway. Who am I kidding? But even if I was wildly considering this, he said, he explained to me, there's risks for this. And the reason they come up with the 35 number, the year of your life that they'll offer this to you, is the risk of miscarriage in the amnio is the same as the risk of Downs when you're 35. So, just that clarified what the risks were for me. So there's risks in a lot of things it's not that we can't take risk in life, right? We just have to do it in a measured way. And, I think it's important to let people know that when they undergo medical procedures, that they not that they have to Google every horrible thing that can happen, but they have to be a little informed.
Well, I think when it comes down to cosmetic surgery, I mean, really? So I think, people that undergo cosmetic surgery should have a realization that, it's not needed to save their life or to necessarily improve their life, but rather so they look better. Typically with cosmetic surgery, if you're doing a lap band or some other, gastric type surgery because you're morbidly obese, that's something that's going to add years to your life. If you're undergoing a colonoscopy screening, that's just all wellness. So I think what you have to do as a patient is you got to weigh the risk and benefit. And obviously most of these procedures, the benefit far outweighs the risk. So, I always recommend to, when you have a car accident case and someone comes to see you and their back's bothering them and they've had a surgical consult and they've been told, well, you could have surgery on your back. I always convey, look, if you need the surgery, if you absolutely need this surgery because you can't walk, you can't move your limb, or you can't feel it, then get it. But if you think you're going to increase the value of your claim by having surgery, none of those things exist.
They got to look for their health. Yeah. They got to look for their health.
Yeah.
So I wanted to ask you, because you have some really interesting cases. I thought about just going on vacation and relaxing, and when you use a jacuzzi, thinking that that's just, another way to relax. And by that time, it's late at night. Usually people want to get in a hot tub. They may be 3 sheets to the wind, or they may have had just a few glasses of wine. They're not thinking that they're necessarily putting themselves at any arm's risk. But you have a body of cases, particularly here in Florida, where people have contracted Legionnaires, and that's a lethal disease that, that can kill you, right? Or Absolutely. Just cause you terrible problems. What kind of circumstances is it with a jacuzzi or a hot tub that would cause that to happen? And as a consumer, how should you be a little wary of this?
Okay, so let's start off with the premise that heated bodies of water, we're not talking about 60, 70, 80 degree water. We're talking about, 95 to 110 degrees. Okay. I think it may go up to 120 degrees, but we're thinking about warm water. Think of a petri dish. Think of everything that potentially is growing in this hot water. All right. Now add some bubbles, and all of a sudden the steam's rising and you got these water bubbles, and now you got water particles in the air. They've been aerosolized. So now you walk by this hot tub, or you're sitting in the hot tub, right? And you're breathing in these bubbles. So you're breathing in this water in the air. And what happens is, if the hotel or if your community didn't keep that hot tub clean, meaning there's scum on the scum line, they haven't kept the chlorine levels up, it's a breeding ground for any bacteria. And so Legionella bacteria is a normal, bacteria that just grows in the wild. So
you're almost any
some of it there.
Okay.
Now, almost any jacuzzi is going to have a little bit, but it's killed as soon as the chlorine hits it if it's not on the scum line. So if they're not changing the filter like they should be every so many months, if they're not sweeping down the sides of the jacuzzi so that there's not a scum line, you can expect there's probably a high level of Legionella in there. Now, if you swallow the water, it's not gonna have an environment.
Interesting. Right? Okay, so it's not ingesting it; it's breathing it, going into your lungs.
Right, and so Legionella essentially is a bacteria that when you breathe it in, you ingest it into your lungs, it's going to cause pneumonia. And if you are elderly, let's say these 55 plus communities where they have people that are 55 plus, well, over time we know people hypertension,
Yeah.
may get different types of diseases. And so if you've been compromised, immunocompromised, you're that much more susceptible to becoming sick from Legionella.
So if you live in a community that has a jacuzzi, if you lived in a community that had a jacuzzi, what would you be on the watch for?
I would definitely look at the sides of the hot tub to make sure there's not a buildup of scum on the side. That's one. So if there's not a buildup of, say, dirt and scum on the side, if there's not a buildup because they're brushing it, right? You want to brush this jacuzzi just like you brush your teeth. There's no difference. So you're brushing the jacuzzi on a regular basis, whether it's once a day, whether it's once every 2 days, just enough so there's no scum line. So that's one. Two, if you live in this community, you want to make sure when you walk by it, you at least smell some chlorine, right? Not having chlorine in the water is a really good sign that they're not taking care of that jacuzzi.
Right. So when I go to this gym and they've got that, I'm not going to go in that hot tub anyway, but I'm just saying, I walk in sometimes and they've got the pool and the hot tub right by the door, and I smell chlorine and I think, oh my gosh, that's a lot. But
that's a good thing because it's sanitizing the water and it's preventing a buildup of bacteria such as Legionella. So that's a good thing. The other thing you want to look for if you live in that community, if you don't see anybody coming out on a daily basis or whenever you go out there, if you don't see someone coming out, at least, when you're out there, if you go out in the morning or whatever, and cleaning it. Okay. So if there's no pool company that comes out and cleans it, that's a pretty good sign that
administrative or CDC or some rule of thumb that they're supposed to go by.
So the Florida Department of Health has guidelines on maintaining appropriate levels of sanitation for jacuzzis. Yes. So they would, again, it should be cleaned daily, probably tested daily. So what happens is the Florida Department of Health has a requirement pursuant the Florida Administrative Code that requires these types of spas to be checked on a daily basis, and the check-in needs to be recorded on a daily basis for chlorine, pH level, etc. So if they're not doing that, that's a pretty good sign that you might want to avoid breathing in that water vapor as you walk by the spa.
What freaked me out, what freaked me out is when I was reading one of these cases, and basically it said that these people were walking by the jacuzzi, like they didn't even get in. But people splash and all that, and somehow they breathed in this water vapor. I also think about some of these indoor places that the vapor, is there.
Yeah, you don't have to actually jump in the spot to contract Legionella. It's not that you're in the water. It's not that you drink the water. It's that you breathe the water vapor that has the high level of bacteria.
So if you are on a homeowner's board, or if you are involved in your community, you live in a community that has a pool and a hot tub, and I mean, as far as it goes, a pool, since all water naturally occurring has Legionella, but not to the amount that, in other words, you have to kill it. It's not like something that just, it's something that's naturally occurring that has to be killed with it.
Well, it's got to be sanitized with chlorine. So if you're not keeping the sanitation levels correct, so so certain circumstances, you don't range just about every day here in Florida, right? And any of these outdoor hot tubs,
and it's hot as hell anyway,
are hot. So the chlorine's evaporating. Now, when you take and you add different people that are in and out, they're taking chlorine out too, just same as a pool. The spa, when people are in and out, they're removing the chlorine. The chlorine's sticking to their body and they're getting out with chlorine. So the level goes down and down and down and down based on these factors. So if they're not maintaining the chlorine levels, this is what happens. You'll end up getting a high level of bacteria. Could be Legionella bacteria. Someone could breathe it in. So if you do live in a community and you want to make sure that your hot tub or your spa is being, maintained appropriately, you can always ask the HOA or management for a daily log. And you can look and you can see on the daily log, are they doing it every day? Are they doing it every other day? Are they just doing it 3 days a week? In other words,
Have you had cases where there were hot tubs or one, two, three, four more people were sickened by this?
correct. So I've had cases where, an HOA, a management company, only hires this pool cleaning company to come out 3 days a week. So they record 3 days a week. What about the other four, right? So we don't know what the chlorine levels are on the other four. And so over time, and if the pool company's coming out and the guy's checking the level of chlorine, but not sweeping it, not pushing it down, and that scum line gets thicker and thicker and thicker with, bacteria, bingo, there you go. So someone's eventually going to get sick.
And what I've seen about that, I mean, this is a catastrophic thing in the sense that it affects somebody for the rest of their, I mean, I know it can be fatal, I know you can die, but it also can affect you, the quality of your breathing for the rest of your life.
It could have a profound effect on someone who contracts it. It may take them quite a long time, or they may not recover with regard to their breathing issues. So, and it could potentially cause or contribute to someone's death. So it's a serious matter. And that's why the health department has guidelines. And, the health department, the way they work with the disease processes in situations like this, if they have one reported case, they'll go out and they'll test the water, right? And then if the water comes back positive for Legionella, they'll shut the spa and the pool down until they remediate. Unfortunately, the first time for remediation isn't as great as the next time. So they may represent that they've remediated, right? But they didn't actually sweep it down, clean enough, change the filters, etc. Mm-hmm. All they did was over chlorinated.
Jack the chlorine.
Yeah, they just jacked the chlorine up. So what ends up happening in the cases I've seen is they jacked the chlorine up, reported it to the Department of Health, who comes out and does a recheck and says, yes, it's over chlorinated. They must have killed everything, probably. They haven't. And then they open up the spa. And now, when the next person suffers Legionella at that spa, they close it down and they require them to comply with a remediation to prove they've done X, Y, and Z. So they've got to drain it. They've got to change the filter. They've got to clean it, serious cleaning, and where they just kind of acid wash the whole pool, where they're killing everything.
Well, no wonder they don't want to. I mean, I wonder if that's something that should be done every year or every so often anyway. But they don't want to maintain it. They don't want to spend the money. They don't want to spend the time. And that's what causes this kind of neglect, is what causes this kind of profound sickness with people. So if you're on an HOA board, or you're living in a community where there's a hot tub, then really you should be checking to make sure that people are cleaning it, even if you don't get into it, because you can be affected by it. People that you know or care about can be affected by it just from breathing in the droplets. And so you should be checking that there is a company coming out, that they are sweeping the scum down right, that they are adding chlorine, and that they're properly taking care of it so that it can be a safe experience for somebody.
And one tell sign to check that would be easy to check is just ask to see the log. It's a weekly log. It's typically on a form provided by the Florida Department of Health, and they can just see, if the dates are sequential, the first, the second, the third, the fourth, the fifth. If they're not sequential, or they don't have that form, or they're not maintaining that form, then I would stay away from it.
And if I lived in a community like that, and I wanted to avail myself of this, or kind of even if I didn't, after I know about these cases where you're just walking by it and you breathe it, I would want to see that log was in place. I would want somebody to be aware of this danger, and because it's not something that people normally are aware of. And I would want somebody to know that I'm aware of it, that, that there are people on the board, there are people in the community that are aware of this. And even if they think that it's nothing to bother about, that there are people who will be upset if the guidelines aren't taken care of or not adhered to. But what do I go on vacation now? Okay. And I don't know anything about the hot tub there. And I'm at a hotel and it seems kind of nice. And again, I've had my few glasses of whatever I'm drinking and I'm relaxing. I'm not thinking about it. There's no way for me to know, is there?
absolutely no way, except if you have your senses, okay, and you before you climb in the hot tub, you don't smell chlorine, don't go in the hot tub. If you smell chlorine, and as you're getting in the hot tub, if you see a scum line, okay, if you see a scum line, I'm not talking about bubbles or foam. I'm talking about scum line around the hot tub. Don't get it.
So let's say that a person goes to a hotel and maybe the lighting's not good, or they're just not aware about this, and they do contract Legionella. It's not diagnosed quickly, is it?
So there's an incubation period. So I would say to anybody who's contracted, first of all, no one knows they've got Legionella.
Right. Who's going to think that? They're going to think they're getting a cold or a flu or whatever.
Right. So if you get flu-like symptoms, you get fever, you might even have a cough. If it's difficulty breathing, if you have a temperature, and you show up at the ER thinking, I'm sick, and they say you've got pneumonia, one of the things you might want to tell the ER physician is, if in the last 7 days you were in a hot tub, you might want to convey, hey, in the last 7 days I was in a hot tub and now I'm sick. That way they're on the lookout,
right,
potentially can test you for Legionella.
Well, because, we go to the doctor and we think, okay, we walked into the doctor's office, they're going to be able to tell what's wrong with us immediately. But in order to know if you had Legionnaire's disease, wouldn't they have to take the bacteria and culture it and all that? So that would have to be an occurring thought with them, and it's not a naturally occurring thought. So
typically what they do is they'll give you a broad spectrum antibiotic to address the pneumonia.
Mm-hmm.
But Legionnaire's disease may need a more specific antibiotic. So they don't just typically test for Legionella, right?
It sounds like an old medieval disease.
Yeah,
you wouldn't think that.
You show up and they're not typically, unless you're in the hospital, they're not going to take a sputum sample and run a culture and see what it is. They usually just go, oh, you've got pneumonia, let me prescribe this, and they prescribe a broad spectrum antibiotic. It doesn't work. You continue to, suffer.
And as you continue to suffer from pneumonia, this can harm your lungs. It can kill you.
Yeah. So, I would tell people, if you've had exposure to a hot tub in the last 7 days, you got flu-like symptoms, and you're having difficulty breathing, and the doctor says you got pneumonia, say, I was potentially exposed to Legionnaire's disease because I was in a spa in the last 7 days.
That could save their life. That could save a person's life, and certainly alter the course of their treatment, because if they get the right antibiotic and it's cut short,
they could make a full recovery if it's caught early enough. Sure.
That is great information. I did not know anything about that. I don't go in the hot tub that much on vacation, just because I've just usually eaten a large dinner and I feel like I'm going to look 9 months pregnant in a bikini, and that's all I wear. So I watch everyone else in the hot tub. But now I don't even want to get near them unless I smell chlorine, and at least they look a little clean. No scum line. But I think, all kidding aside, that it's important if you live in a community to know these things, because it's not something that you would naturally think about. And it's certainly important if you've been on vacation to know this, so that you can ask the medical professionals for the right help.
So you're at least looking when you're on vacation, so you can make an educated decision whether or not you want to jump in.
Right.
So if you have some basic information, it's not foolproof.
Nothing's foolproof like this, right?
I guarantee if it smells like chlorine and there's no scum, that you're not going to get Legionella, but there's a great probability you will not. It's just, if the pool looks dirty, it doesn't smell like chlorine,
don't chance it.
Stay away.
Thank you so much. I am so excited that you are coming on board, and I know that you will come back on this podcast, because you have so many different stories and anecdotes, and based on cases, obviously, that you just can't reveal the names, about medical experience that will help us all, enlighten us, just to be, not neurotic, but a little more thoughtful when we do things that can put us in danger.
Certainly, if people who undergo a procedure kind of have an idea of what to look for, if people have loved ones who are persistent, with medical care and treatment. The squeaky wheel gets the oil. That's how it works in medicine. That's how it works in life, right? So you can just convert that over to medicine. So if you're if you're an advocate for your loved one, and your loved one's not in a situation to ask questions, you're with your loved one, ask away, be persistent. Be persistent.
I think that greatly enhances your chances that the outcome is favorable.
Absolutely.
It's, so thank you so much. And,
Sure. Thank you.
and we will be doing this again.
All right.
Thanks.
Thanks.